May I request Mohammed Hanish IAS for the keynote address.
Distinguished panelists, Dr. Sreekumar, Dr. Prijit, Dr. Vinod, our dignitaries of the dais, distinguished personalities, ladies and gentlemen. It gives me immense pleasure to speak before you with regard to the emerging trends and also related to the various challenges that's being posed before the mankind in the health sector in the 21st century. In the 21st century, we find that there has been a greater deal of preponderance of non-communicable diseases, and there has also been communicable diseases on the upswing. An interesting variant has been brought in by way of the interplay of the different organisms, plants, animals, and the human beings together with regard to the spread and the prevalence of various ailments across the globe. This has been especially so in the tropical regions. India, for instance, and Kerala in general, has been unwittingly enough a kind of prey, or unwittingly enough a prey to these kind of diseases as well. So this gave rise to a paradigm shift from the kind of the systems that have shaped the health system, its policies, programs, formulations from 1950s. This state had been the pioneer in terms of the massive inoculation drives, the inoculation drives that were conducted during the times of the Raj, the first princely state to see to it that vaccinations were conducted, and by the time it was 1947, with the galloping pace at which literacy was progressing, along with a greater deal of focus on providing primary health centers and systems, things progressed. Heavy expenditure was made from the government sector, along with parallel expenditure from the private sector, towards building up the primary health care, the secondary and the tertiary care. Somewhere down the lane, there has been a kind of a diffusion of pattern happening all over. When certain ailments, certain small diseases or inconveniences that were sought to be deliberated upon, dwelt upon at the primary health center level, suddenly got graduated to the secondary sector and the tertiary care altogether. It may perhaps be a reflection of the progress in the lifestyle that has come to be in the case state of the people of Kerala. Maybe that the expectations and the kind of visualizations about who should we consult and who should treat me happen to grow bigger and bigger, with the result that a migraine or a small fever began to be treated in medical colleges. This was in fact a kind of a major deviant, a major variant from whatever we had in mind when we went for the heavy expenditure that was made in the primary health sector. Primary health sectors ultimately became kind of showpieces for very substantial segments of a society. So, when myself along with the Honorable Chief Minister and the team went along to the Republic of Cuba and also tried to understand what we mean by the polyclinics and tried to copy the same concept over here even 10 years back, it never found traction here for the sole reason that people did not really believe in taking their ailments to the primary health center. This in fact got accentuated or exacerbated, I should say, with a tremendous focus on specialities and super specialities by the private sector as well. They did a world of good. At the same time, the kind of societal preferences also went for a 6 as a result of the preponderance of the sophisticated systems that we had across the state. Today, after the 1990s, when the governmental expenditure in various social sectors like education, second is health and social welfare, began to take a toll as a result of the huge deficits in terms of the budgeting process. We had to take the beating. It resulted in a kind of a gradual decline in terms of, or decay in terms of the quality of services that have been rendered by the primary health centers. The same thing happened for the secondary care centers also. Suddenly we got shifted to the tertiary care centers wherein huge volumes, huge influx of patients happened to be the order of the day, and the patients and the doctors had a tussle on a daily basis. This results in the kind of man-to-man conflict which we find all the time in medical colleges and similar institutions, the kind of skirmishes which happen all over. Many experienced practitioners over here would definitely vouch for the fact and concur with me when I state that the government medical practitioners are under tremendous pressure. Along with it, we also have certain certain interesting anecdotes also, certain incidents also happening with every passing day. Now here, along with it, we had this problem of the NCDs, the non-communicable diseases, and the trauma care systems to be put in place. In the case of the One Health platform, that's how, when in tune with the guidelines, in tune with the philosophy of the World Health Organization and similarly situated international multilateral organizations, we strove to create the One Health platform. What exactly is One Health platform? We try to integrate the services, the works done by different sectors of the governance together to see to it that the various ailments and the kind of malaises afflicting the plant kingdom, the animal kingdom, and human beings together are addressed together. Because there is a kind of a continuity in terms of the problems that's been created across. That gives rise to, look at the way in which such very interesting outbreaks like Nipah and dengue and leptospirosis and everything spreads all over. On a daily basis, on a yearly basis, we would see that there is a curious spectacle happening in the state. Bats are found across the world, but it's only the bats in Calicut district which have the propensity to create the Nipah outbreak. I don't know what is the connection between Calicut district and Nipah virus as well. Something to be studied. We have a Center for Nipah Research that's been established for it. And there is this World Bank project that has just begun, which would really be a kind of a major, solution for many of the issues that confront Kerala and the country in general. This is the biggest project that's been made by the World Bank in the recent times, which comes to have an amount of almost 3,500 crore rupees to be spent across 5 years. The Kerala Health System Improvement Program. The 4 planks of this World Health Project are A, the non-communicable diseases and the surveillance mechanisms and the systems, B, the trauma care systems that are to be put in place, and C, it's about the One Health platform that's to be created, and D, about the digital governance that has to improve considerably. Even today, we find that the medical practitioners find it extremely difficult to state or rather utilize the e-health systems so as to give the kind of medication, the kind of consultation to be done, the pharmacy systems to be carried out, the lab diagnosis to be done. If at all it could be integrated together in the public sector and the private sector on a wholesome scale, we would be actually, saving on a great deal of time, effort, and the kind of human resource as well. We need to look at that. In terms of the One Health platform, we can certainly state that theoretical constructs are always possible. But beyond that, it's a question about how an avian influenza can definitely impact a human being. The culling of the animals, the ducks that has been going on in Kuttanad and Alleppey sector is not the kind of answer that is to be provided. The other day I was telling the district collector Alleppey that you could have certainly gone very well with 20,000 ducklings being culled. But then he was telling me a different story altogether. So it is just that the hatcheries themselves insist that the ducklings may be killed for the compensation that comes in. The lopsided priorities and the kind of knee-jerk responses, knee-jerk reactions that have really resulted in a kind of an absolutely haphazard and short-sighted approaches to the resolution of these issues needs to be tackled completely. It needs to be tackled, eliminated completely. And let's see to it that absolutely sure-footed, far-sighted, and mature decisions and solutions come about. This can come about only when the experts in the medical sector put their heads together with the brilliant personalities in various other sectors like the animal husbandry, forestry, agriculture, fisheries, and so forth. Otherwise, what would happen is that on an annual basis, on a monthly basis, this state and this country can be subject to the vagaries of nature, the various ways by which the kind of travails, the trials and tribulations that affect different organisms across the globe can certainly have an impact on the human life. In terms of the infant mortality rate, in terms of the maternal mortality rate and all other indicators, we can always state that there has been a kind of steady progress in the Sustainable Development Goals. But remember, as against the past, when we had such a huge distance separating Kerala from the rest of the states, today they are almost peeping in the post. Many of the states whom we used to berate and deride have actually done tremendous work, especially some of our neighbors. And today we find that at the taluk level, CT scans are available in taluk hospitals across Tamil Nadu. Similar are the case with many of the states which we used to once upon a time berate as the Bimaru states. We can never call them as the Bimaru states. We need to very clearly state that these are states that have really been quite focused about the way in which state expenditure and private sector priorities should go hand in hand, and they should be complementary and not contradictory. We have a surfeit of experience, plentiful opportunities coming in. Today we need to have a greater deal of focus on what exactly is needed, which ailment will be addressed, and what is the approach to be adopted. These are questions which certainly should engage the minds of experienced personalities over here, administrators, planners, thinkers, intellectuals. In terms of the World Bank project, which has just started off, and it has got the approval of the DEA and the Government of India as well as the Government of Kerala, and is to roll out on November 1st positively. That can certainly provide us with a great deal of expertise and the finances that are required in terms of correcting the mid-course corrections that are to be done for the state of Kerala. My team groups, which include many of the doctors over here, and also the crisis, the core groups have been doing a great deal of work along with the World Bank teams. But then we had already had the discussions with the World Bank to see to it that larger sections of the society, informed sections of the society, are involved with the thought process. And we would certainly fan it all over to see to it that better thoughts, better perceptions, and better knowledge value systems, values are brought into to bear so that this system or this program becomes a great success. For the part of Government of Kerala, we have been trying our level best in terms of trying to correct whatever has been going on in the name of traditional systems in inverted commas. These traditional systems have to change. The shibboleths of the past are to be consigned to the trash bins of history. We need to embrace a new future, a new tomorrow, wherein every person would have the dignity, would have the right, would have the privilege to see to it that quality healthcare is ensured. I hope and pray that these deliberations and the informed sections, informed personalities over here can take over this message, spread it all over, and collaborate, cooperate with us so that consensus, a great deal of confluence of ideas is brought in. I thank the Trivandrum Management Association for giving me this prestigious occasion, opportunity to speak on this matter. Thank you very much and all the best.
We have with us Dr. D. Sreekumar as an eminent speaker for the session. He worked as assistant professor at the Kerala Agricultural University, later with Rajiv Gandhi Institute of Veterinary Education and Research, Puducherry, and he is presently with the Arawali Veterinary College, Sikar, Rajasthan. He is a member of Indian Veterinary Council, Indian Dairy Association, Indian Society of Animal Production Management, Society for the Conservation of Domestic Animal Biodiversity, and Zoo Outreach Organization.
A warm good morning to all of you. I am Dr. Sreekumar from Arawali Veterinary College, Sikar, Rajasthan. And here I would like to present upon the One Health system or One Health approach with specific reference to biodiversity, with reference to the infectious diseases and the other nuances of the diseases, transmission and all. We have specialists from different fields. I'll be limiting my talk on to the biodiversity aspect of towards a One Health ecosystem. Yeah, the key concepts of this presentation will be focusing on human beings, animals, plants, environment, and its relationship with One Health. Next, please. The One Health concept or One Health approach can be defined as a collaborative, multi-sectoral, transdisciplinary approach which is having its activities at the local, regional, national and global level, optimizing the health outcomes, interconnecting humans, plants, animals and the environment. One Health for well-being, food security and sustainability, and the One Health triad, healthy human beings, healthy environment, healthy animals, form the essential feature or the essential outcome of the One Health approach. And if we look into the transformative outcomes, if we have a holistic approach towards the transformative outcomes of the One Health system, as far as the animals are concerned, it goes with the capacity of adaptation, and as far as the plants are concerned, higher productivity, resilience, sustainable agriculture, and as far as the human beings are concerned, reduced risk of future pandemics or outbreaks, and as far as the environment is concerned, it is definitely biodiversity conservation. And improved climate change mitigation strategies are necessary for improved environmental health. Better quality, traceable food is an important aspect, not only for human beings, for animals. For plants, food nutrients are required from the soil, and the soil should be replenished with nutrients. This takes us to the adage, when we protect one, we help protect all. And this goes in line with the schematic representation which we had. Why One Health is important? Let us look into the different factors that is designing the significance of One Health. So people live close by and there is changes in the climatic pattern, the land use pattern has changed over years, more global travel, trade, and animals are now more than just food animals. See, we keep a lot of animals as companions and pets, and of late we have gone to the extent of keeping many reptiles even as pets. All these make animals come closer to human beings, and there comes a spread of zoonotic infections. The human population increase, industrialization and anthropogenic activities are actually leading to global warming, which is a cause of climate change. And these changes in the environment will be responsible or are responsible for emergence and re-emergence of infectious and non-infectious diseases. See, for example, this has been well illustrated by the different viral epidemics which we had. And all these things actually point towards the interdependence of these systems, human system, animal system, plant system, and the environmental system. The components of the environment, if we look into, we have the biotic and abiotic factors. And in the biotic factors, the one that is recently added is the human-animal conflict. We'll touch a bit into that. In a complex environment, animals experienced varied microenvironments. Animals there is a constant interrelationship and interactions between animals and humans, and also animals and environment. So all these things lead to the needs. I have enumerated certain needs, especially for animals, but these needs are the needs of humans as well. And if we are not providing the needs, if we are not satisfying the behavioral needs of animals, that will cause a change in the behavior of the animals. And this change starts as a sort of anomalous behavior. After some time, if it is not addressed, it will turn to abnormal behavior. And still, if it is not addressed, these behavioral changes will be fixed in the animal in the form of vices, and the animal will continue to show these vices throughout its life. Let us go back in the early 1960s when Ruth Harrison has written a book titled Animal Mechanics. In this book, he has brought out the sufferings of animals, especially those animals being used as food animals. And these sufferings, and he has concluded that these animals, especially those animals that are used as food animals, they just exist and they don't live a full life. And this has created hue and cry among the people. People have come to the streets. There were a lot of protests leading to the formation of a commission by Professor Rogers Bramble. And in 1965, Professor Rogers Bramble has come out with 5 freedoms for animals. And what really matters to animals can be explained by the Bramble report, who stated that animals, any animal for that matter, should have the freedom to stand up comfortably, lie down, turn around, groom its body, groom themselves, and also stretch their limbs in the case of animals and stretch the wings in the case of birds. And animals should be kept in a positive state of welfare. And this is all the more important. And this here applies the 5 freedoms onto the animal welfare. The situation as of now is very alarming. The majority of the animal husbandry operations, farming operations today, are aimed at maximizing profits without looking into the welfare of the animals. The needs and well-being of the animals are being compromised. Farm animals are now being reared as factory farms or in factory farms, where the space is limited. And if we look into the situation of poultry, wherein the birds are being given less than a A4 size paper space for one bird, the problem here is that the farmers think that if the bird is allowed to move around, bird is allowed to freely walk, there will be less of body weight happening, there will be less of eggs being produced by the birds. So much of restricted space, so much of constriction will lead to a lot of problems, will lead to bad welfare. High welfare farming is a practical solution, and we have come across high technology farming or high tech farming situations wherein everything is mechanized. Animals, when it is time to be milked, will come to the milking parlor, will be milked by machine, and the milk, a sample of the milk will go to the computer. They will assess, that will be assessed for the composition of the milk, the quantity of milk, the fat percentage of milk. Depending upon that, signals will be sent to a particular area wherein the correct quantity of feed for that particular animal, for that particular day, depending upon the composition of the milk, fat percentage, and the total quantity of milk produced will fall before the animal after the milking. Not a gram more, not a gram less. Animal will have to eat it and go. Yeah, change is already happening. There are battery system of rearing poultry wherein the birds are confined in cages, and that is being banned in many countries, but not in India. And from 2013 onwards, the European Union countries have banned usage of farrowing crates. I'll just explain what is meant by farrowing crate and it will be clear now. On the left hand side, you see a pig delivering in a farrowing crate, where the pig is not able to move. It can just stand, eat, and maybe turn left or right, whereas the young ones are able to move. And on the right hand side, you see a situation wherein the pig is free to move. And this is the situation with poultry, and the one you find on the top is with regard to the birds that are used for laying, layer birds. Actually, now the situation is being changed all over the world except in India, wherein the birds are left free, and that is called as free range system. And the eggs that you get from the free range system is almost costing double than the eggs that you get from the cage system. And these changes will have to take into account the traditional knowledge, experience, and the beliefs of the farmers, especially of the people who rear animals and birds. And when we talk about the traditional knowledge, elderly people will come to know about these things, and they have seen these things. Even I have seen these things, but as far as the students, younger generation is concerned, they are not aware of these things. They might not have had a chance to see these things. And these are the traditional practices that is vanishing, or that has vanished already, gone into oblivion. There is no koitha part now. Everything is done by machines, mechanized. Biodiversity is the entire life on earth. It consists of organism, ecosystem, the environment, and actually consists of the different species, including human beings, and also the genetic diversity, the genes that make up the life. And let me go into a case study, a recent case study that was published in Nature News in 2 days back, and it has come in the Guardian newspaper 1 week back. Biodiversity loss is the biggest driver of outbreak of infections, and it was done on an experimental basis, and scientists have compared around 1,000 environmental drivers in different continents except Antarctica. Situation is different over there. And they studied the diseases affecting animals, plants, and human beings. The study was not human-centric. And it was found that results were found to be similar in human beings, human diseases, and non-human diseases. And the researchers noted that many drivers were interconnected. Say, for example, climate change, pollution, habitat loss, all these things lead to biodiversity loss. And when there is biodiversity loss, the law of nature, there will be something else that is coming up to occupy that place. And when that is so, the species that is remaining, they become more competent, and they are the competent ones that result in transmitting the diseases. And if you look into the things, the results of this particular research study, it has been considered as a big step forward in science, according to a global climate change biologist. And the climate change and also the habitat loss has resulted in many animals moving closer to human beings. And this becomes a potential trap for the transmission of diseases. And as I have told earlier, when there is extermination of a particular species, that space will be occupied by other species by means of species introduction. And in this case, when insects occupy that space, they become vectors for the transmission of some or many diseases. And if you look into habitat loss resulting in biodiversity loss, these are the things that lead to human-animal conflicts. And when you talk about human-animal conflicts, it can be of any animal for that matter. But in this case, I have taken the indicator animal as the elephant, because more problems are being created by elephants. And why? And what are the drivers of these conflicts? Basic thing is that animals don't behave as we want them to do. And also, as far as the elephant is concerned, the huge structure, huge size, the need for large quantity of feed, large quantity of water. And generally, behaviorally, elephants cannot stand at a particular place. They keep on moving. They keep on moving kilometers and kilometers. And the path through which they move can be said to be a corridor. Now what is happening is that because of urbanization and because of loss of habitat, the corridors are being turned into many things. And the ecological dimensions of conflict, this human-animal conflict, can be divided into the animals that come to raid can be of opportunistic raiders. Given the opportunity, there is no protection, they come inside. Or maybe habitual raiders, they come and they do it habitually. That process is repeated. And maybe obligate raiders, because there is something that is making the animal do that. And there is a human perspective and there is also animal perspective to this particular aspect. And these are the human perspectives and these are the animal perspectives. And as far as conflict management is concerned, there are certain strategies. And one of the strategy, one of the most important, practically important strategy is the restoration of elephant corridors. That is a very difficult procedure. But if you have seen this, there has been a recent positive change and that has come in news 2 days back. I have got this news from Madhubhumi Daily 2 days back on 14th. It was given that restoration of elephant corridor, and that has happened in Malappuram in Kerala, and wherein 4 acres of land that has been the corridor for elephants, now human habitation is taking place there, has been purchased by 2 NGOs. And they have handed over, they are in the process of handing over to the Forest Department, and Forest Department is in the process of getting sanction from the government to declare this as a forest area, elephant corridor, which will help around 340 elephants along with other animals also. And this is a very good sign. So whatever we just look into that, we say that nothing is good. And this is a very good sign, and the management specialists will have to look into, take this as a clue and see what can be done to prevent animal-human conflict. And this is one of the best examples how this can be controlled to a great extent. And for the effective implementation of One Health program, I have charted out some all-inclusive, holistic approach of plans. And any one of these will be suitable to meet out our demands. And while going through the brochure of this convention, I've seen that some of the plans that are good enough will be taken up, and those plans will be implemented within a period of 1 year. Not that the convention will go as a convention. And how to go about? These are some general plans wherein we can think which is suitable for our planning, for the planning of TRIMA. And the specific plans, public consultations including individuals, families and communities, we have to reach the grassroots level. For that, a lot of effort has to be taken up. And collaboration between institutes includes individuals, family, society, and finally the population. Enhancement of natural resources is something that is beyond the thinking of event management specialists. Now we have to see that, taking the example of people taking up the human habitations for making an elephant corridor at Malappuram. This should be taken as a clue, and lot of discussion has to be taking place on this. And as a take-home message, I say that long-term consideration should be there for sustainable management. Thank you very much.
First of all, thank you, TRIMA, for inviting me for this particular very important conference or meeting on One Health. And I was wondering how come the management sector has taken up finally this One Health approach, at this particular time of the, period. And we heard our chairman speaking in the inaugural address, as well as the Honorable Governor speaking on comprehensive healthcare. And though I am a scientist by profession, I am also an Ayurveda Vaidya and practicing physician as well. So this is where I would like to take you to a totally different perspective of seeing this One Health approach and where we had failed and the prospects or the way forward that at least I strongly feel Corona was not the last virus to visit this planet. There will be more in the offing. So until and unless it comes, then only we don't have to plan for things when something invades. So what are the future prospects or possibilities, learning from the experience that we had from the COVID-19 pandemic that just got over. So coming to, as you all know, what is One Health? I don't have to deliberate on that. It has been spoken much. And One Health is an integrated, unifying approach to balance and optimize the health of the people, animals, and ecosystems. We have heard a lot. And as I was telling about the earlier one, that on the COVID-19 pandemic, the gaps in One Health knowledge, prevention, and integrated approach were seen as key drivers of the pandemic. So what were those gaps? This is what I would like to address in the due course of my presentation. And what defines One Health ecosystem? As you know, it encompasses the interconnectedness of human, animal, and environmental health. It emphasizes collaboration between multiple disciplines, including medicine, veterinary science, ecology, environmental science, and public health, to address health challenges comprehensively. So, coming to One Health, different aspects of One Health, you can see that the prevention and control of disease, promotion of when it comes to prevention and control of disease, One Health strategies can help prevent and control the spread of infectious disease, reducing the risk outbreaks that can affect individuals, families, communities. And then the promotion of environmental sustainability. We always think about why One Health is significant for family, community, and societal health as a whole. So, and also the economic benefits. If you look at the World Bank report, the expected benefit of One Health to the global community was estimated in 2020 to be at least US $37 billion per year. And since 2003, we had seen that over 15 million human deaths and US $4 trillion in economic losses due to the disease of pandemics, as well as immense losses from food and water safety hazards, which are One Health related health threats that we had already seen. So, resilience to health threats. One Health strategies enhance resilience to health threats by fostering collaboration and coordination among diverse stakeholders, including healthcare providers, veterinarians, environmental scientists, policymakers, and communities. This collective approach improves the ability to detect, respond to, and recover from health emergencies. Then we have the promotion of equity and social justice, which is very important, as by addressing health disparities and promoting social justice, One Health initiatives can improve health outcomes for particularly the marginalized communities and promote equity in access to healthcare and resources. So, how do human, animal, and environmental health sectors interact within this One Health ecosystem? By disease transmission, environmental impact on health, shared resources, shared pathogens and antibiotic resistance, collaborative research, and surveillance. So these are some of the aspects that which have of great importance. How can individuals contribute to the One Health initiative? Promoting awareness. Individuals can raise awareness about the interconnectedness of human, animal, and environmental health among their communities, peers, and policymakers. Sharing information about the importance of One Health can help garner support for collaborative efforts and encourage behavior change. Adopting sustainable practices. That then responsible to pet ownership, supporting local health, local agriculture, advocating for policy change, participating in citizen science and educating others. If you are to go into the depth of all these things, it will take a long time. I'm sure this is, you can, it's there in the net as well. So, coming to the, why are the roles of individual, family and the community in the implementation of One Health initiative? Individuals, education and awareness, adopting sustainable practices, responsible pet ownership, advocacy, as I said, families, communities, and why adopting a One Health approach is urgently critical now. Adopting a One Health approach is urgently critical now due to several current global health challenges like pandemic preparedness and response, antimicrobial resistance, environmental degradation and climate change, food security and nutrition, health inequities and social justice. How has the increase in human-animal conflicts impacted the One Health framework? We heard in detail Dr. Sreekumar speaking on the human-animal conflicts. So I don't have to go into depth, but that's of a great concern as well. Like disease transmission, ecological disruption, and livelihoods and food security, social and cultural impacts, One Health collaboration are some of the topics which comes in this particular area. What does this mean for future strategies? This is also very important. An integrated management, community engagement and participation, conflict resolution and mitigation, surveillance and monitoring, policy and legislation. By integrating these components into future strategies, we can effectively address human-animal conflicts within the One Health framework, promoting the health and well-being of both humans and animals while safeguarding the integrity. What barriers currently exist in implementing a One Health approach globally and locally? These were some of the points which were asked by the organizers to talk on. So that's why I'm pointing on this particular area. That is silos and fragmentation, lack of interdisciplinary collaboration, resource constraints, policy and governance challenges, knowledge gaps and data sharing, social, cultural and behavioral factors, communications and awareness are the barriers currently existing in the implementation of One Health approach globally and locally. Coming to how can these be overcome through policy and community engagement? Again, policy development and coordination, capacity building and training, resource allocation and funding, policy advocacy and stakeholder engagement, community participation and empowerment, communication and information sharing. These are the takeaway points that TRIMA can actually look into for effective implementation of this One Health approach. How can healthcare, wildlife and agriculture sectors better collaborate to achieve these One Health goals? By fostering collaboration of the interdisciplinary training and education, integrated surveillance and monitoring, joint research and innovation, policy alignment and coordination, capacity building and training again, community engagement and outreach, and public awareness and advocacy. By fostering collaboration among healthcare, wildlife and agriculture sectors, stakeholders can harness their collective expertise and resources to address complex health challenges. So these are some of the examples that we have seen of the One Health initiatives. It's not just speaking, but we have seen what have happened in the world so far of Global Polio Eradication Initiative, PREDICT project, rabies elimination programs, agroecology and sustainable agriculture, One Health Central and Eastern Africa, which have been effectively handled. What lessons can be derived from the broader application if you look? Interdisciplinary collaboration, community engagement and participation, surveillance and early warning systems, and all the other sectors as well. What are the empirical models of or tangible markers available to measure the effectiveness of One Health implementation? If you look, it is disease surveillance and epidemiology. Epidemiology is a great thing. What I strongly feel that every time a pandemic or an epidemic happens in the world, actually in particularly Indian context, you have to look in an epidemiological study have to be seriously conducted. I don't think it has been effectively conducted in the case of COVID-19, which I'll come on in the next slides that I'll be presenting. Can initiatives be effectively designed to promote widespread adoption of this One Health practice? Yes, financial incentives, regulatory incentives, capacity building incentives, market-based incentives, recognition and awards and collaborative partnerships as well. These are some of the integrated health concepts that we have seen. The One Health, Eco Health, Global Health, Conservation Medicine, Biodiversity and Health, Agri-Health, Health Pluralism. I would add one more, which will be soon you will be seeing, maybe Whole Health or Holistic Health or whatever you want to see. So this can go on. We have had enough and more concepts already. Integrated health paradigms like Eco Health and Planetary Health was there. Now we are talking about One Health. We look forward to Whole Health soon. So this is very important. This is where my second, I'll finish it up soon. I had presented the first part of the story, what you would have all seen and which is very common and which is there in the net and, which is known to the policy makers. From this, I would like to, I'll just end up in 5 or 6 slides, but this is very important. See the point where, point number 4, using the traditional knowledge of indigenous people and local communities for One Health Joint Plan of Action 2022-2026, which has been designed by the World Health, WHO, UN, FAO, as well as World Organization for Animal Health. That particular point number 4, is very important in the context of particularly the Indian context, and I would say from the Kerala perspective, very important. Why? Because I'm coming to that. We have enough, we have this particular sloka from the Ishavasya Upanishad. Everyone knows, Ishavasya idam sarvam yatkinja jagatyam jagat tena tektena bhunjida ma grida kasya siddhanam. The entire world, static as well as dynamic, is pervaded by the Supreme God. Hence, enjoy the pleasures in a detached manner. Do not be greedy. This wealth does not belong to anyone, from the Ishavasya Upanishad. So, traditional knowledge from the context of, from an Indian context, it is nothing new to us. This had existed from time immemorial and it is still existing. And by, looking into, I just quoted one example. There are so many examples, Prakriti Rakshati Rakshita, and so many examples in our Upanishads and Vedas and Puranas that we can see how the ecosystems, biodiversity, animals and human beings interacted, lived together happily, and we could see in all through our classics if you look through. Aushti Sukta from the Rig Veda in which we often quote in Ayurveda. The Aushati Sukta, which very well explains about the O divine plants. You are so fertile in nature. You are the blessed with all kindness and happiness. O divine plants, always be kind to us. Pour happiness over us. You have the power of the horse. You are the destroyer of fatal diseases. You are the guardian of mankind. Save and protect us from all kinds of illness. From the Rig Veda, one of the oldest treatises in the world. So, speaking on Aushti Sukta. Same thing is echoed by the Kani tribe of which live very close to our place, the Kani tribal community. They have a song which they sing in praise of the biodiversity, conservation, living in nature. And if you look at the particularly the tribal communities which I have been working in, I have been working for the past 30 years on systematic documentation of traditional knowledge related to plants used for food and medicine among the tribal communities in Kerala. Past 30 years I have seen how they live in nature, how they live in forest, one with nature, engaging with, without disturbing the nature per se, sustainably utilizing the resources that is, which is found around them, and how they are quite happily living. But that is also changing, the present generation is changing due to, urbanization which has reached to the forest patches as well. So we can see a same thing among the, tribal communities as well. Now the traditional medicine, when it comes to the sum total of the knowledge, skills and practices based on the theories, beliefs and experience indigenous to different cultures, whether explicable or not, used in the maintenance of health as well as in the prevention, diagnosis, improvement or treatment of physical and mental illness as described by WHO. is what the definition of traditional medicine, Coming to this, we can see from the from One Health initiative, this traditional medicine from the Indian context, how we have collaborated, which we have these systems called Ayurveda, as you all know, and then we have the Vriksha Ayurveda treating with dealing with the management of plants, trees, environment, biodiversity. Then we have the Mriga Ayurveda. Again, we have the Gaja Ayurveda or the Ashwa Ayurveda, Gava Ayurveda or Pashu Ayurveda, and these how they are complement to each other, and how we have it has been existing for thousands of years here, managing so many epidemics and pandemics that have visited this planet, this part of the world, which have been effectively handled by these systems of medicine as well, called particularly Ayurveda. As you know, the concept of health in Ayurveda is samadosha samagnischa samadhadu malakriya prasanna apnaindriyamana swastha ityabhidiyade. This, and it is not just the absence of disease or but which encompasses, if you look at Ayurveda, it's a biodiversity based medical system. So all these aspects are taken into consideration where we call it as complete or total health. Same you can see it in the Charaka Samhita in the Sharirasthana, which talks about Loka Purusha Tulyattu Darshana, where microcosm, we are a microcosm in this macrocosm, and whatever exists in the world exists within us as well. The Pindanda Brahmanda Aikyam, also explained in so many classical literature in this part of the world. All this proves how we had known this particular living with environment in this ecosystem, not contradicting each other but complementing each other. Janavadodhvamsan, which we can call it as the COVID-19, we can equate to the Janavadodhvamsaniyam in Charaka Samhita, dated back to 1st century AD, explaining about the again the abnormalities are now appearing in Charaka Samhita Vimanasthana. It says that Nakshatra, Griha, Chandra, Surya, Anila, Nala, Disha, the forecast abnormality in the coming seasons. Very soon, the earth will cease to manifest proper, Rasa, Virya, Vipaka, and all those things. And this is bound to result in the widespread manifestation of diseases. Therefore, O Agnivesha, all of you should collect herbs before the time of destruction and before the earth loses its fertility, leading to the impairments of Rasa, Virya, Vipaka and Prabhava in particular. We shall administer these herbs with proper Rasa, these things, and treat diseases. It is not difficult to treat epidemic diseases provided the herbs are collected, preserved and administered properly. So I just want to conclude with this thing is that, as Gandhiji correctly said, I don't want my house to be walled in all the sides and my windows to be stuffed. I want the cultures of all the lands to be blown about my house as freely as possible, but I refuse to be blown off my feet by any. This I am telling in the context of where we missed out. I would say we missed the bus. When the whole world was gripping in darkness during COVID-19 in the initial stages, when the advanced countries like Spain, France and Italy and other countries were stuffed with only one medical system which didn't have a clue for as a curative or a drug for COVID-19, we had systems like Ayurveda, Siddha, Unani, Naturopathy, Homeopathy and all the Ayurvedic systems of medical system, legal medical systems in India, practiced here, widely practiced here, particularly in Kerala, which was evident. And then we were banned. Particularly the Ayurveda was banned in the beginning. Only preventive steps were allowed to be taken during the COVID-19 when there was no medicine at that particular point of time in this giving away so many lives, innocent lives without a drug. And because Ayurveda or Ayurveda systems were not allowed to be practiced, but only preventive steps to be taken. Unfortunately, if all these legal systems together, along with Western medicine, as Dr. Hanish Mohammed Hanish was saying, the primary care and secondary care could have been easily handled by these Ayurvedic systems of medicine, very easily handled. And the tertiary care should have been handled by the Western medicine. Then we could have reduced the load to the major hospitals, particularly medical college and all the leading hospitals in Kerala as well as other states. But we did not, make that opportunity. I think that was a major flaw that we had. These systems, we have all these systems here, even now being practiced. And I would say I don't have anything to to tell that I have not been vaccinated. I'm not against vaccines. None of my family members had vaccinated, and a lot of my friends and on record I'm saying, have been vaccinated, or even my brother or sisters. I didn't ask anyone to do it. I said I am not doing it because unless this is proved as a very effective vaccine, then I'll look into it. But I would say that so many people have been saved through these Ayush systems, I would say, and we had this particular culture in this land, particularly in Kerala, of of looking into these traditional systems of medicine, particularly Ayurveda, for effective management of not only certain diseases but even pandemics. Sarve bhavantu sukhina, sarve santu niramaya, sarve bhadrani pashyantu, ma kaschid dukkha bhag bhavet. Not only for Bharata but for the entire world, loka samasta sukhino bhavantu. Thank you.
Who's currently working as a technical officer, One Health and Zoonosis at the WHO country office in India. He previously worked as associate professor and head IC at Kerala Veterinary and Animal Sciences University, and as an officer in charge of the Center for One Health. He also served as a part-time international consultant for WHO in Maldives, focusing on food safety. He holds a doctorate degree in veterinary public health. To you, sir.
Thank you. That was it. I'd like to thank the organizers for inviting us here in this beautiful event. The most important thing in this event is the audience here. What's so specific in this audience is that you all represent a true One Health. This is not that One Health represents by health or veterinary sector. Each and everybody of you, whatever platform you work, you have a role to play in One Health. With that introduction, let me move on to my presentation. So while I was researching on the topic, because we had two eminent speakers here who spoke on biodiversity, wildlife and human-animal conflict, as well as the basics of One Health and traditional medicine. So the next important component which One Health has importance is the zoonotic diseases. And when it comes to zoonotic diseases, I researched on some of the aspects of Kerala and how Kerala is identified a lot of zoonotic diseases. So as far as some important zoonotic diseases are concerned, in May 2011, the health system identified West Nile fever for the first time in Kerala. Then in May 2013, Kaizener forest disease was first identified in Wayanad district of Kerala. So I'm just going to highlight all the first incidences, and you can, over a period of time, you will understand that zoonotic disease is a very important threat, and nearly 60% of the disease which are zoonotic comes from the animals as well as vice versa, and nearly 80% of them are from wildlife sources. Then in 2013, there was identification of Lyme's disease again in Nulpura Panchayat in Wayanad district, and here it was 6 plantation women who went for fireworks, a collection of firewoods, and they got tick bite and they suffered from this disease. And that true One Health approach actually started in Wayanad district because of the investigation from Lyme disease, because the health sector contacted the veterinary sector, and we all went for investigation in 2013. And 2014, the university, as a result of such investigations and collaborations, they developed a center for One Health called Cohort. Then in 2014, in the month of November, there was a massive outbreak of bird flu in Alapura district, and many birds were culled. Then again came the hero Nipah virus. I think many of the heroes who work for Nipah virus are here in the stage. So here it was in May 2018 where the Nipah virus incidence was first observed in Kerala. Then in January 2020, 28th January to be specific, we had the first report of COVID-19 in India in Kerala by a medical student. Then Zika virus was first identified in July 2021, and in July 2022 we had this monkeypox virus. So in brief, so this you can see almost all the diseases are zoonotic and very important as far as public health perspective is concerned. Right now we also heard about two diseases, that is West Nile fever, which is in the news recent times. But we we have to understand one thing, that all this disease requires a multidisciplinary role. In fact, West Nile, the One Health approach actually started in America because of the West Nile incidents. There was a doctor who was named as Tracy McNamara. She worked in a zoo called Bronx Zoo. And what could she identify is that at that time there was outbreak of disease in humans where people died due to encephalitis syndrome. And what this doctor identified is that there are a few birds, crows, were also dying in that area. At the same time, some birds in her zoo were also dying due to an unknown disease. And to her surprise, those birds which are native of America were dying first, but those birds which are imported from Europe were perfectly healthy. So that made the hypothesis look, okay, why these birds are dying? So it could be a new disease. Because if it is an American bird which is dying, it may have an inherent antibody to resist the disease. So as a result of her curiosity, she went to the different labs and identified that this was a West Nile fever. And West Nile has an important zoonotic significance because it is commonly seen in birds as well as in horses over a period of years. My presentation will be answering three basic things. What are the probable reasons why we get quite such diseases nowadays in Kerala or in India or in other places? What are our measures to do the next? And some important learnings. As the organizers told, you have to showcase some important success stories also. So as a result of it, some success stories of One Health during my past experiences in Kerala while working in Kerala. So as you all understand that Kerala is a huge diaspora. We have many people traveling all across the world. Especially, and not only that, even the population density is quite high. Forget Kerala, even in India, it's the population density, population numbers and all are quite high. And as Sir was telling, there is also a huge increase in demand of protein-rich diet. The newer generation populations, they prefer more non-veg diet, and also the purchasing power is more when compared to the olden times. So if you go to a hotel, you see more people eating biryani and non-veg nowadays. So what I'm saying is that when there is a huge demand for such protein-rich diet, certain practices like factory farming and all may exist even in future, because the animal husbandry has to meet the demands of such protein. So when you talk about diaspora and things like that, there are chances that some diseases which are new to a particular place can enter into a state. And also we have a lot of migrant workers which are working here. Now coming to another important thing, that is we people in Kerala are more aware. Our media is quite strong. People even one case of any new disease, it will reach to the minute of the population there. I have been brought up by hearing the radio songs which my grandfather used to put. Of course, that's not my grandfather there, but every day, every morning I get to hear the radio songs as well as the news. And it's same here for most of us here. After the radio, then came this news, Doordarshan, then came the various other channels, and finally we have the social media. And we are up to date with what are the latest things which are happening. The most important point is a strong and robust health system, the surveillance systems. See, we all have, in India, we have this IDSP, IHIP surveillance system where, we can, near real time, we can understand the disease scenario. And such surveillance system is quite strong here, and not only in the government sector, even in the medical colleges, we have certain cell like prevention of epidemic and infectious disease cell, as well as state disease control and monitoring cell. And in fact, during the COVID time, we had a beautiful dashboard also. And this dashboard used to give us all information, community kitchen, all things, everything available in one particular click. Likewise, we have given a lot of importance to the daily reporting and situation, what is the reports and things like that. Every day in the evening, we used to have news highlights, like what are the status of the disease in this. So people are becoming more aware of the threats as well as what is going on in the state. And next thing is we are focusing on whole genome sequencing also, because we get to know like exactly where is this particular pathogen is coming from, if it is from which sources, and how it is linked to the broad epidemiology. We have to remember that certain habits like human encroachments into the forest and all leads to the emergence of certain viruses. Like for example, the Kaizen forest disease, monkeys, they destroy the natural habitat, they try to invade into the human population. Likewise, we have the Nipah virus. Bats gets, from the natural habitations, they go into the new areas, and as a result of which they may transmit the disease. And setting a stage on the zoonotic disease in this platform, I want you all to understand how the concept of One Health came actually into the picture. So we all started with astrological theory. We all believed that first, that is way back, long years and years ago, we all believed that the stars and celestial bodies and all decided our future. Over a period of time, then came the miasmatic theory. Miasmatic theory is something like if there is a foul smell in a particular area, that area could be a focal point for disease. Like we had this way back in 1885 in London, we had this cholera outbreak, and John Snow identified that this cholera outbreak could be from a particular hand pump which is located in that center of the city. So that time miasmatic theory was there, and people are not actually identifying what could be the cause of the agent. But certain scientists like him, what he did is he just removed the pump of the handle, and he was able to control the disease to a certain extent. So likewise, then came the theory of humor. Many concepts like I've mentioned, many like we are all meant, if our humors, our fluids are maintained in a balance, then we are healthy. The yellow bile, black bile, phlegm, and the blood. Then came the germ theory. Louis Pasteur and Robert Koch and all, they have pioneered some of the important concepts as far as germ theory concerned. There are certain microorganisms which can cause the disease condition. Then came that agent, host, and environment. That is what you call as ecological theory. Like there is a agent, there is a host, there is environmental influence for any disease causation. So this is how medicine is slowly evolving. Then came the theory of multifactorial causations. Like for example, for non-communicable disease, we don't have a particular agent, then there are different causes. Over a period of time, we understood that all this comes under the One Health and One Medicine umbrella. And we have a beautiful definition for One Health, which is already told by our eminent speakers. That is, it's an integrated unifying approach that aims to sustainably balance the health of man, animal, and the surrounding environment. So this actually, the quadripartite group, that is FAO, WHO, OIE, VO, WOHA, and UNEP have signed an agreement, and they are all collaborating for the sake of One Health. And as a result of which, they have identified few high-level expert panels, and this definitions which are actually seen is coming from the quadripartite and the high-level expert panel. And we have certain tools and things like that. I think more on that will be given by my supervisor, Dr. Ritu, will be sitting here and will be explaining to you tomorrow. So if you see over the period of years, there is always an increasing trend of disease outbreak. And that's why we all understood the pulse of One Health. We are, okay, like the next slide will clearly explain, like see. If you just look at this slide, okay, there are many diseases which are circulating in wildlife population. And when domestic animals goes into the forest area, they, through the vectors like ticks, mites, mosquitoes, and through these vectors, they get the disease from the wild animal sources, and they transmit to one or two individuals at the household level. Over a period of time, they transmit the same disease to other individuals in the household, and it amplifies to more and more number of individuals, and if they travel across the world, it becomes a pandemic. So this is how basically the disease emerged over a period of time. So if you are looking at an angle of addressing the human health threats at a human perspective alone, we are just addressing the third part alone. Rather, if you are addressing right from the surveillance part in the wildlife, that is early warning signals and things like that, we could actually control the disease at the source. So this is generally how the outbreak and disease spillover happens. You can see the gray curve shows the wildlife disease. Yellow one shows the animal amplification and the red one shows human amplification. So if you practice control measures at the source itself, we can decrease the human outbreak as well as we can decrease the animal outbreak. So over a period of time, certain emerging zoonotic diseases, they tend to disappear. And apart from this, we need to know that animals act as sentinels for many incidents. You must have all heard about cannery and coal mines, right? The cave, the coal mine people, when they go into the cave, they carry the bird in a small cage called cannery. As these birds actually identify there is any noxious gases in the cave, and as a result it flatters the wings and shows symptoms, and the person in the cave comes out. It indicates that there is a danger beyond a certain level. So that type is actually acting as a sentinel. So like for example in KFD, if there is a few monkeys dying, we generally think that okay, that could be a sentinel event for Kaizenur forest disease. Likewise, certain asbestos and all can cause mesothelioma cancer in dogs at a much earlier level than when it actually impacts the human beings. Studies have shown. So it's actually, even if the family is smoking in the house, the dogs gets cancer more earlier than the human beings. So it's a danger sign that okay, you have to be precautionary. Always remember, One Health does not addresses one particular component. It addresses a vast array of components, including climate change and things like that. And AMR is one of the important things. See, WHO considers AMR as one of the top 10 threats which is going to face by the mankind. And as a result of which, antimicrobial resistance is said to be a silent pandemic. We don't know when actually we are going to get the disease. And it is estimated that we can, if the situation goes on, 10 million deaths per annum will happen in the year 2050. So we have to be aware that AMR is going to be a threat. So in animal as well as in the human sector, we use antimicrobials for different purposes. An animal, like for example, we use for metaphylactic purpose for control of disease, prophylactic purpose for prevention of disease, therapeutic purpose for treatment, and also sometimes there are chances that people use for growth promotion. So we need to identify which are those antibiotics which are in the pipeline which has use in the human medicine, and like for that we have various tools in WHO called as AWARE and things like that which is available. Now, when I was called for the talk, I always remember Dr. Sreekumar sir, who has actually taught me BVSC. I am a veterinarian, so veterinary science was taught by Dr. Sreekumar sir, and he was specialist in wildlife biology. So he taught me one thing, that if you are chasing a deer for some time, suddenly it will die. Then I was thinking like, okay, what could be the reason? See, there's something called as capture myopathy. That's basically, the functions of the heart muscles gets weakened because of certain stress. That is, if you are chasing a deer, they get stressed and they start not die, or at least they collapse. So that was existing in the veterinary sector since 1955. But similar situations, what was seen reported in human health sector, especially when we hear some trauma and sudden news, our heart gets weakened up, and that's something called as Takotsubo cardiomyopathy. That situation was identified in 1990. But you imagine if there is a cross-talk between 1950s within veterinary and human health sectors long back, certain small lives could be saved with the similar conditions. My last part is to give an idea about what are the initiatives done by the government sectors as far as One Health is concerned. Only one initiative, that is called Kaizenur forest disease. Way back in 2015, we had an outbreak of Kaizenur forest disease where 18 humans had died due to the disease. So what happened is that, see, basically in Kaizenur forest disease, monkeys act as a reservoir. They get the disease, even though they are reservoir, they also die due to the disease. And before they die, as their temperature is high, they want some water to drink. So usually they go near the water source and they try to drink some water there. And immediately after drinking water, they will die near the water source if they are infected with KFD. And as your body gets cooled down, the ticks comes out from the body of the animal, and if at all there is some animal which are grazing those areas, they get the tick bite, or they harbor the ticks, and they take it to their home. And when humans get exposed to these animals with the ticks, especially the nymphal stages, which are very active, it's just like this. It just wants some source of blood to drink. So immediately it gets a blood, it drinks, and then it gives you KFD virus. Okay. So so I'll just move on fast. So what basically is that at that time in 2015, every year, that time this district administrator organized a meeting. They called the different sectors, and as a result of which they prepared a guideline, like what are the roles of various sectors as far as a KFD outbreak happens. I'm talking about One Health in field. So as a result of guideline, they have a own control number, and whenever there is any monkey death, immediately a call goes from the control number to the forest sector. From the forest, the call goes to the veterinary sector, and the veterinarians as well as the from the university, if there is any pathologist, they go and conduct the post-mortem. They wear all the PPE kits as well as they take vaccines against the disease. They send the samples via health department to a recognized lab. Usually it is National Institute of Virology, which deals with all biosafety pathogens. And then at the site where the monkey death is seen, they dispose the carcass on the site. Postmortem also is done on the site, and samples are taken, and those areas are fogged. And sometimes you can go for controlled burning, because being a forest area, we have to always remember the forest fire and all that may happen. And then there is a daily reporting system from the administration side, followed by control of vectors by putting some anti-tick preparations in the body of the animal. This is also practiced by the animal husbandry department. And health, of course, has a major role where surveillance, OSPOR identification, vaccinations, awareness, everything is done by the health sector, and coordinating between different sectors. Then we have some tribal departments. So that's what I'm saying. All the sectors has a role to play. Even the media, because they are having an important role in public alerts as well as alerts. So it's basically an approach which utilizes the. We are not going to bridge. We are only bridging the sectors. We are not going to act as a sector. Like if there is a particular sector which is having a good role to play, we are just supporting it. So to conclude, One Health has gained increased traction in Kerala, and we generally see the emerging zoonoses like Nipah, KFD and all have underscored the need for a proactive One Health approach that usually transcends the traditional barriers of working through silos. And with the help of One Health, we can control not only the zoonotic disease, we can address AMR, climate change and other trends. So just as a quote, when I is replaced by B, even illness will become wellness. And thank you all. We have to remember our position is not in the center of the scheme. We are just a part of the entire universe where animals are there, plants are there, and things. Then only we can work collaboratively. Thank you, one and all.
You have had very illuminating points coming out of the erudite speakers, learned members. Unfortunately, for want of time, we cannot have a question answer session right now because the next session is already overdue. But nevertheless, I would not want to disappoint you who have got questions. You could interact with the speakers during the lunch session since we are already running short of time and we would want to start the next session. Is that okay with you? But what you can do for now is please put your hands together, give them a great applause. Thank you very much.
This sums up our first session of the series. May I request to kindly hand over a token of gratitude to our speakers. I request Mr. Sreekumar to kindly hand over the token of gratitude to Dr. D. Sreekumar. On behalf of Grow Tree, we will be planting a bountiful tree for the villagers at Fatehabad, Haryana. May I request Mr. R.A.D. Pillai to kindly hand over the token of gratitude to Dr. Vinod Kumar TG. May I request Colonel R.G. Nair to kindly hand over the token of gratitude to Dr. Prajit Nambiar. On behalf of Grow Tree, we'll be planting a bountiful tree for the villagers at Fatehabad, Haryana.